Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery, respiratory system part 1. In the current session, we will be discussing about the CPTs regarding nose. The CPT range is 3 lakhs to 3 lakhs 999. First of all, coming to nose, the nose is again categorized into these following subtopics: incision, excision, introduction, removal of foreign body, repair, destruction, and finally other procedures. The CPT range for incision is 30000 to 30020. For excision, it is 30100 to 30160. For introduction, it is 30200 to 30220. And for removal of foreign body, the CPT range is 30300 to 30320. And for repair, it is 30400 to 30630. And for destruction, it is 30801 to 30802. And finally, other procedures, they come under the range 30901 to 30999. First of all, coming to incision, the first CPT is 30000. It deals with drainage, abscess or hematoma, nasal, internal approach. And for external approach, you need to refer 10060 and 10140. The next is 30020, drainage, abscess or hematoma, nasal septum. And for lateral rhinotomy, see specific application. For example, 301182 30320. Next, coming to excision, the first CPT is 30100. It deals with biopsy intranasal. And for biopsy skin of nose, you need to refer 1102, 1103, 04, 05, 06 and 07. And next is 30110. Excision, nasal polyp or polyps simple. 30110 would normally be completed in an office setting, and to report bilateral procedure, use 30110 with modifier 50. The next is 30115, excision, nasal polyp or polyps extensive. Previously it is simple, now it is extensive. And it requires facilities available in a hospital setting, hence the term extensive. And to report bilateral procedure, use 30115 with modifier 50. The next CPT is 30117, excision or destruction, for example by laser, intranasal lesion, internal approach. And for excision or destruction, intranasal lesion, external approach, that is lateral rhinotomy, the CPT is 30118. The next is 30120, excision or surgical planning of skin of nose for rhinophyma. The next is 30124, excision, dermoid cyst, nose, simple skin, cutaneous. The next is 30125, excision, dermoid cyst, complex, under bone or cartilage. The next is 30130, excision, inferior turbinate, partial or complete, any method. And for excision of superior or middle turbinate, you need to use 30999. Please remember that this is for inferior turbinate. And for superior or middle turbinate, you need to use 30999. The next is 30140, submucous resection, inferior turbinate, partial or complete, any method. And do not report 30130 or 140 in conjunction with 30801, 802 and 930. And for submucous resection of superior or middle turbinate, you need to use 30999. And for endoscopic resection of concha bullosa of middle turbinate, use 31240. And for submucous resection of nasal septum, use 30520. The next CPT is 30150, rhinectomy partial. And for rhinectomy total, The CPT is 30164. For closure and or reconstruction, primary or delayed, see integumentary system 13151 and 13160, 14060 and 14302, 15120, 15121, 15260, 15261, 15760, 20900 and 20912. Next, coming to introduction. The first CPT is 30200, injection into turbinate therapeutic. The next is 30210, displacement therapy, Proth style. Next is 30220, insertion nasal septal prosthesis, button. For example, button. Insertion nasal septal prosthesis. Now coming to removal of foreign body. The first CPT is 30300, removal of foreign body intranasal office type procedure. The next is 30310, removal of foreign body intranasal requiring general anesthesia. Next is 30320, removal of foreign body intranasal by lateral rhinotomy. There are three different CPTs. Now let us see an example. Johnny has a penny removed from his left nostril in the doctor's office. So this is a office type procedure. And removal of foreign body from left nostril. So the CPT is 30300 along with LT modifier. Removal of foreign body intranasal office type procedure. Now coming to repair. Before going into CPTs, for obtaining tissues for graft, see 15769, 20900, 20902, 20910, 20912 and 20920, 922, 20924 and 21210. And for correction of nasal defects using fat harvested via liposuction technique, see 15773 and 15774. The next, coming to the first CPT in repair, it is 30400. Rhinoplasty primary, lateral and alar cartilage and or elevation of nasal tip. And for columnar reconstruction, see the sequence 13151 and next CPTs. The next is 30140. This is also rhinoplasty. Previously it is primary. Now it is complete. 30140 deals with complete rhinoplasty. External parts including bone pyramid, lateral and alar cartilages and or elevation of nasal tip. The next is 30420. Rhinoplasty complete including major septal repair. Whenever complete rhinoplasty is performed along with major septal repair, the CPT is 30420. The next is 30430. Rhinoplasty secondary, minor revision. For example, small amount of nasal tip work. The next is 30435. Rhinoplasty secondary, intermediate revision. For a revision, that is bone work with osteotomies. The next is 30450. 30450. This is rhinoplasty secondary major revision. Minor revision, intermediate revision and major revision. Major revision includes nasal tip work and osteotomies. The next CPT is 30460. Rhinoplasty for nasal deformity secondary to congenital cleft lip and or palate, including columnar lengthening tip only. If the rhinoplasty is performed for the nasal deformity due to congenital cleft palate or cleft lip, the CPT is 30460. It includes tip only if all tip, septum and osteostomies are included. For the rhinoplasty for nasal deformity, if all tip, septum and osteotomies are included, the CPT is 30462. The next CPT is 30465. Repair of nasal vestibular stenosis. For example, spreader grafting, lateral nasal wall reconstruction, etc. And do not report 30465 in conjunction with 30468 469 when performed on the ipsilateral site. 30465 excludes obtaining graft. And for graft procedure C 15769 20900 20902 910 912 920 922 924 21210 and 21235. And for repair of nasal vestibular lateral wall collapse with subcutaneous or submucosal lateral wall implants, use 30468. And for repair of nasal valve collapse with low energy temperature controlled, for example radio frequency, subcutaneous submucosal remodeling, use, this is a new code 30469. And 30465 is used to report a bilateral procedure, and for unilateral procedure use modifier 52 to indicate reduced services. The next CPT is 30468, repair of nasal valve collapse by subcutaneous or submucosal lateral wall implants. Repair of nasal valve collapse by subcutaneous or submucosal lateral wall implants. And do not report 30468 in conjunction with 30465 and 469 when performed on the ipsilateral side, that is same side. Contralateral means opposite side. And for repair of nasal vestibular stenosis, you need to refer 30465. And for repair of nasal vestibular stenosis or collapse without cartilage graft, lateral wall reconstruction or subcutaneous or submucosal implant, you need to use 30999. This is important. Next, 30468 is used to report a bilateral procedure. And for unilateral procedure, use modifier 52. The next CPT is 30469. This is a new code. It is indicated by this symbol. Repair of nasal valve collapse with low energy temperature control. For example, radio frequency, subcutaneous or submucosal remodeling. And do not report 30469 in conjunction with 30465, 468 when performed on the ipsilateral side. And for repair of nasal vestibular stenosis, you need to quote 30465. And for repair of nasal vestibular lateral wall collapse with subcutaneous submucosal lateral wall implants, use 30468. And for repair of nasal vestibular stenosis or collapse without cartilage graft, lateral wall reconstruction or subcutaneous or submucosal implant, use 30999. And 30469 is also a code used to report a bilateral procedure. And for unilateral procedure, use modifier 52. Next CPT is 30520. It deals with septoplasty or submucous resection with or without cartilage scoring, contouring or replacement with graft. And for submucous resection of turbinates, use 30140. The next CPT is 3050. It deals with repair choanal atresia intranasal. The next CPT is 30545. Repair choanal atresia transpalatine. And do not report modifier 63 in conjunction with 30540 or 545. Choanal atresia is nothing but a congenital condition that causes narrowing or blockage of the nasal passageway by a tissue or bone. It mainly affects the choana, which is the passageway that connects nose to the throat. Atresia is nothing but a condition in which an orifice or passage in the body is closed or absent. Next CPT is 30560. It deals with lysis intranasal syncytiae. We know that syncytiae are nothing but adhesions which are formed between the adjacent structures. Next is 30580. Repair fistula oromaxillary. Combine with 31030 if anthrotomy is included. The next CPT is 30600, repair fistula oronasal. The next is 30620, septal or other intranasal dermatoplasty. Do not include obtaining grafts. Next is 30630, repair nasal septal perforations. Now let us see an example. A patient's nose was hit with a baseball during a high school baseball match. At that time, reconstruction was performed with local grafts, and the patient now returns as an adult. Discontent with the bony prominences along the bony pyramid and flat look of the tip of the nose. He underwent major repair with osteotomies and nasal tip work. Here, previously patient has undergone the rhinoplasty and now he is undergoing secondary rhinoplasty. So the CPT is 30450, rhinoplasty secondary major revision, because it includes nasal tip work and osteotomies. Hence it is a major revision. So 30450 is the appropriate CPT, which includes rhinoplasty secondary major revision. Now coming to next topic, that is destruction. The first CPT is 30801, ablation soft tissue of inferior turbinates, unilateral or bilateral, any method. For example, electrocautery, radiofrequency ablation or tissue volume reduction, superficial. And for ablation of superior or middle turbinates, you need to use 30999. The next CPT is 30802. Ablation soft tissue of inferior turbinates intramural. For example, submucosal. And do not report 30801 in conjunction with 30802. And do not report 30801, 802 and 30930 in conjunction with 30130 and 30140. And for quadri performed to control the nasal hemorrhage, you need to see 30901 to 30906. Now finally coming to other procedures. The first CPT is 30901. It deals with controlled nasal hemorrhage. These are the CPTs that are employed for epistaxis. Control nasal hemorrhage anterior simple, limited quadri and or packing, any method. And to report bilateral procedure, use 30901 with modifier 50. The next is 30903, control nasal hemorrhage anterior complex. Previously it is simple, now it is complex. It requires extensive quadri and or packing, any method. And to report bilateral procedure, use 30903 with modifier 50. Next one is 30905, control nasal hemorrhage posterior with posterior nasal packs and or quadri, any method, initial. Next is 30906, control nasal hemorrhage posterior with posterior nasal packs and or quadri, any method, subsequent. The next is 30915, ligation arteries ethmoid. The next is 30920, ligation arteries internal maxillary artery and transanthal artery. And for ligation external carotid artery, use 37600. The next is 30930, fracture nasal inferior turbinate therapeutic. And do not report 30801, 802 and 30930 in conjunction with 30130 or 30140. For fracture of superior or middle turbinate, use 30999. And finally, 30999 deals with unlisted procedure, nose. Now let us see an example. A 43-year-old female in the emergency room with severe epistaxis, that is nasal hemorrhage. She said that this is a common occurrence for her during the cold, dry months of winter. This is why she is here for the third time. and extensive bilateral posterior quadri and packing is again required to control the hemorrhage. So this is a subsequent visit and extensive posterior quadri is required. So the appropriate CPT is 30906 and it is a bilateral procedure along with 50 modifier to indicate bilateral procedure. 30906 indicates control nasal hemorrhage posterior. Here posterior quadri, posterior with posterior nasal packs and or quadri, any method subsequent, because this is a subsequent visit, you need to go for subsequent. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.